This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Okay, so overnight we had a patient that came in with a large vessel occlusion, and I just wanted to quickly review what those are and what the signs are of them. So does anyone know what we're talking about when we're talking about a patient that has a large vessel occlusion, an LVO? So M1, what is M? What are we talking about with M? So it's talking about the middle cerebral artery. So, and then yes, the 1 is the first segment of it. And then also proximal M2s also are amenable to thrombectomy. So that's one of them. Are there any other vessels that count as being an LVO? Yeah, exactly. Your ICAs, your internal carotids. And then are there any others? So your basilar is another one that counts as a large vessel. Now, if someone had one of those, what kind of symptoms would you expect them to have? Someone occludes their proximal MCA. You could have aphasia, that's right. Any other symptoms that could happen if someone had another? So weakness. And it wouldn't just be a little weak. You would expect someone to have a super dense hemiparesis. So the way I kind of think about it is that if you are blocking off a major vessel, the first thing that's going to be affected is going to be your cortex. And so if someone's going to have cortical signs, just kind of map out the major areas of the cortex and you'll get what the deficit should be on exam. So the acronym that I remember learning was FANG-D, FANG-D. And so the F was for a field cut, so occipital region, visual field cut. Then the A is for aphasia, so that's going to be, again, left side, kind of frontoparietal region. Then the N is for neglect. That's just the opposite side. So that's basically your awareness of existence of things. So have a patient always do the left side, test, hey, whose arm is this or whose watch is this? And if they don't recognize it at all, they don't really answer it, then that's evidence of neglect. Then the G is for gaze deviation. So some of these patients will come in and they've got a fixed right-sided gaze. That's a sign of an LVO. And then the last thing, the D, is again the dense hemiparesis. So the whole left side of their body should not be moving, right? So if someone has one of those, that's really important to recognize because your window for an intervention is now outside of the TPA window. You're inside of a thrombectomy window, which is 24 hours as opposed to 4.5 for TPA. So it matters if you can recognize that to activate the stroke team even when you're outside of that TPA window because they definitely have way better outcomes and it's totally amenable to an intervention. So that's just a kind of quick review of those.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.